go to second talk. Technology in diabetes and Ramadan. Professor Evgenya Sokolova from Russia.
Dear colleagues, dear friends, it's a great pleasure for me to be here with you, even online. And today we will discuss together the topic of fasting and diabetes technologies. And of course, first of all, I would like to thank our organizing committee and Professor Ines Shaltu personally for your kind invitation to this wonderful event. And if you want to get anything from my presentation, I mean links or pictures or schemes or whatever you want, you can easily connect with me by email, which is written here, and I will send you everything, whatever you want. I want to start my presentation from the short description of Muslim population in Russia. As you know, my country is very huge, and if you just look here and look to the deep green color, you will understand that we have some region with a great amount of Muslims, and this amount is increasing for now, with increasing percentage and the total numbers and increasing number of mosques. So also very important, and percentage of people who have a favorable view of Muslims in our country is very big. So the problem of diabetes and the problem of fasting with diabetes is also a huge problem in the country, and all of us as clinical specialists know very well that living with diabetes is very difficult, because sometimes if we just in metaphoric way understand that diabetes is like a horse, sometimes this horse can have a very bad behavior with unpredictable conditions. So of course we need to remember about pathophysiology of fasting diabetes patients when we are talking about Ramadan. So of course, there are a lot of tissues and organs and systems which are involved in this process, and we need to remember that even if you want to summarize the biochemical and physiological changes, sometimes it's not very easy, because a lot of parameters are changing, and we are talking about glucose here and about insulin sensitivity, about lipid profile, body weight, inflammation, blood pressure, cardiovascular system, energy consumption, hormones, and basal metabolic rate, and other organs. To fast or not to fast? It's a not very easy question sometimes, because we also need to remember here about personal choice and its importance, about religional practice, and of course about medical recommendations. But if you just try to introduce all these things here, of course there are some lifestyle changes about sleeping, about meal plans and diet, about physical activity patterns, about reduction of diseases such as smoking, about medication adjustments, and all of these changes can influence on diabetes compensation quality. And of course, we need to remember about potential risks of fasting during Ramadan in people with diabetes. And these are hypoglycemia, hyperglycemia, diabetes ketoacidosis, dehydration, and thrombosis. And here, of course, technologies can help us. Technologies around blood glucose level and insulin, of course, we need to remember about continuous glucose monitoring systems, real-time personal monitoring system, flash glucose monitoring, about smart pens, insulin pumps, SAP, LGS, closed loop, artificial pancreas, and even more, because even mobile applications, social media, internet resources, big data processes, artificial reproductive technologies, artificial intelligence, all diagnostic technologies are working here. Just we remind that, of course, we need to use all these mobile applications, but some of them are more applicable here. As example, I always use this application because from my point of view, it's very useful and very interesting in design, and patients very like to use it. So if you don't know anything about it, you can just recommend this application to a patient because it's really perfect. But how can other modern technology help us here? So, of course, there is an increasing recognition of use of technology in diabetes, even in evidence-based medicine. Blood glucose monitoring, exercise time, medication dosages, and energy injection can all be digitalized, of course, and accessed remotely. Pattern recognition in software is also available to help clinicians make complex decisions. Remote technologies like text, emails, video links can improve communication. All these can be used where available to improve care and support for people with diabetes or fasting during Ramadan. If you're just trying to have some sort of summary for the latest research or in technologies in diabetes during Ramadan, you can just go through this list and understand that everything in world of modern technology we can use here. So if you're talking about automated insulin dosing system, is it safe? Yes. During fasting, is it effective? Yes. In type 1 diabetes, what about microdosing of glucagon versus oral glucose? It's effective. What about AGP in type 1 diabetes mellitus with flash monitoring system? All these things are very popular and we can use it with adequate counseling and support. What about continuous glucose monitoring in individuals with type 2 diabetes? Utilizing CGMs to monitor glycemic excursion during Ramadan is important. All this modern insulin pump and hybrid closed loop system is working very well. CGM, personal monitoring in type 1 use is useful. Artificial intelligence can be used for all things about fasting during Ramadan. So it's a short list, but let's just go through main risks during fasting and all implications for technologies here. The main risk, from my point of view, is hypoglycemia because by far is the most common concern for people with diabetes. And we have some studies in this field. And hypoglycemia makes life of our patients as an art of balance and is a major still limiting factor in glycemic management for both types of diabetes. Of course, we know some causes of hypoglycemia with changing of insulin sensitivity, decreased insulin clearance, some problems with carbohydrates, inappropriate insulin injection, decreased intermittent glucose production, and of course, continuous fasting. We need to remember that it's also connected with inflammatory proteins, even 7 days after hypoglycemia, and continuous glucose monitoring is the only way to be sure about the absence of hypoglycemia in any type of diabetes, even for type 2 diabetes is also very important because we need to remember about target levels of blood glucose, we need to remember how you respond, and adjust your food choice. And for now, it's very understandable that we need to use time and range paradigm for utilize all this information from CGM. And of course, we can use all this data from continuous glucose monitoring during our telemedicine consultations because it's very easy to understand what's going on with our patient. And of course, there are a lot of data for now, especially after COVID era, about usefulness of these types of consultations for our patients during Ramadan. And you can understand even here in this very brilliant study, because telemonitoring group was going in a better way than the usual care group here. What about continuous glucose monitoring and data about this? The very high cited study is written here, so it's from a few years ago, but of course the HbA1 level was improved. And you can just look at this here. And another study which with the story about high-risk patients and flash glucose monitoring. It was a group of patients with type 1 diabetes, type 2 diabetes on insulin, gestational diabetes mellitus, diabetes with other concomitant diseases, and it was a story about structured Ramadan education and usage of continuous glucose monitoring, flash one, throughout Ramadan, with brilliant results, not only on HbA1c level, but also for time and range group. Of course, for now, it's also written some guidelines. For example, in this guideline, which is recommend for patients to use continuous glucose monitoring system during fasting, and it's a great thing, I think, for our patients. We have some recommendations for MDI therapy for type 1 diabetes patients during fasting. We have even some advices for insulin pump therapy during fasting. And of course, we need to remember how to use the pump, how to change insulin dosages here accordingly with continuous glucose monitoring data. And it's very important. And also, there are some studies for now about the usage of automated insulin delivery system in people with type 1 diabetes during fasting. And you can look here and understand that even in small studies, now we understand the time and range level is higher in patients who use automated insulin delivery during Ramadan. Just even quick view on this data about insulin dosages, and you can understand that there are no changes in these blood glucose changes and insulin level during Ramadan and before or it. So these systems can be perfectly used during this period of time. And a very recent study, which was published a few days ago, about possibilities of some modern treatment modalities in type 1 diabetes, such as AID. So the usage is associated with the highest rate of time and range during fasting. So you can recommend to our patients with type 1 diabetes to use AID, because 73% in time and range is a great result. What about dairies and about all these things around information about patients? Of course, we need to collect it. And here we can also just very briefly speak about big data during always fasting period. And here I just want to emphasize that we need to collect all this data. Why? Because of course big data will help us to understand a lot of things about fasting in diabetes. But of course, even with all these advantages which we discussed before, we need to remember that there are still some human factors and technology use, and they are like fear of hypoglycemia, numerical literacy, data overload, excessive time requirements, technology literacy, device incompatibility, and of course, human are still humans. So during fastings, we need to remember about new decisions, about education, treatment, technologies, including continuous monitoring, healthcare service. Smart technologies are a part of our life now, and they will help us. And new, very successful devices like AID are coming to our lives. So just to conclude, I want to tell you again that of course we have a lot of things: insulin pumps, insulin analogs, continuous glucose monitoring system, SAP, modern technical things for self-monitoring blood glucose, new oral agents, things for insulin injection, smart pens, artificial intelligence. But the main thing here is still education. And we need to remember about the person, behind the numbers, behind the lipid profiles numbers, behind glucose level numbers, and continuous education in all possible way during the usage of any technologies and diabetes care. So for goals of diabetes treatment, we need to remember about target glucose level, about time in range, about amount of hypoglycemia, no chronic complications, but also about quality of life during all periods of time of our patients, even during fasting period of time. Thank you for your attention. I was happy to be with you, and if you have any questions, you can connect with me by email, which is written here. Thank you, dear friends.
Thank you, Professor Evie, for